Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Jenny Sutherland, and we are kicking off 2015 with a three-part series on an admission to an affiliate, a stay at an affiliate, and a discharge to either back home or to an appropriate setting. And today with me is Sandy Cunningham, a hospital liaison at the hospital. Thank you for coming. And Cori Salvini, admissions marketing director, Hillcrest Commons Nursing and Rehabilitation Center. Welcome to the show.
Thanks for having us.
Wow, good. Happy 2015.
And you too.
Yeah. Now, Sandy, hospital liaison, can you tell me what that means?
Sure. Basically what I do is I work with Berkshire Healthcare. I work in the hospitals as a screener. So I work closely with the case management department of the hospital. And anybody that is interested in a skilled nursing facility stay or needs some services upon discharge that might require short-term rehab, long-term care, they often will contact me to come in and talk with the families and the patient to talk about what the options are as far as long-term care, short-term care, rehab. And I will then visit with get the information regarding the patient, visit the patient and the family, and just talk about what we have to offer within Berkshire Healthcare. Yeah. We do have some our local affiliates that we have Hillcrest Commons, which is in Pittsfield, Kimball Farms Skilled Nursing Facility in Lenox, Fairview Commons in Great Barrington, Williamstown Commons in Williamstown, Mount Greylock in Pittsfield, and North Adams Commons in
So
North
you
Adams.
represent a lot of different affiliates,
Yes.
but all Berkshire.
Correct.
Okay.
Yes.
And at the hospital, there's other people representing other groups?
Yes, people do have choices.
Okay.
Certainly, a patient has a choice. If the decision is that they need to go to a skilled nursing facility, there are other options there. I deal mainly with the Berkshire Health Systems. I work with the case managers, the physicians, the families, and the patient to determine where might be an appropriate placement for them.
Okay.
It could be based on location, their need. Some of our affiliates have certain programs that they offer that might be very beneficial to the patient. So we try to steer them in those directions if that's what is needed.
Sure.
Certainly, if you know where they would like to go, we look to see if they have an appropriate bed, an available bed, and there's other things we have to look into, insurance and other needs and what as well.
So there's a lot going on while somebody's at the hospital, and a doctor might recommend them going to an affiliate or a facility. You're looking at their charts and seeing what they might need and which affiliate might be appropriate for them. And when somebody chooses a Berkshire affiliate, that's really when you kick in. And what do you start doing then? You start talking to the affiliates?
Yeah, we talk to the affiliates to see if they have what they have for bed availability, and if they can meet the patient's needs. We get some information and talk with the affiliate to make sure that they can meet the patient's needs. Meet with the patient and the family to talk about what the option is and what we do have available. And depending on their need, some of the all of our facilities can certainly do short-term rehab. So if someone needs to go in for physical therapy and occupational therapy, speech therapy, all our affiliates will provide that. Some of our affiliates have other amenities that they provide that are uniquely for that patient.
Sure. Sure, and that's a big, vast amount of knowledge about what affiliates have to offer and you steer those people towards the right place. And there's meetings at the hospital with the doctors and the family and the patient and yourself, and that's fantastic. And is this when you start talking to someone like Cori Salvini, admissions director from Hillcrest Commons?
Yes.
That's when you start talking to her, Cori, and you're giving Sandy information about bed availability at Hillcrest Commons?
Yeah, we have a morning call daily with Sandy, the liaison, and the other liaisons to let them know about the bed availability in the facility in the specific programs that we have.
Okay. So Sandy, let's say that a patient is discharging from the hospital and they choose Hillcrest Commons, so you're calling Cori and setting up the meds and giving her information. Is
Right.
that, and what else do you make sure is in place before the patient arrives?
Any equipment needs, if there's specialty equipment they need, you know, durable medical equipment such as walkers, if they need a specialized wheelchair, if they need a specialized bed, IV therapy. Sometimes people do need to go on antibiotic therapy when they go to a skilled nursing facility. We also, Hillcrest Commons has a specialty program with ventilator patients, respiratory. We do take respiratory patients at Hillcrest, and sometimes their needs are very specific as to what they need. There are other programs. We have a bariatric program at Hillcrest. So we sort of, you know, try to get those in place prior to them going, and work with the doctors too, because sometimes we need to have a, you know, physician-to-physician call to make sure that things are in place. And
so there's a continuum of care from the hospital to the affiliate, and all those things get put in place. And this is where, from that point, even prior to admission, you're talking with the potential new admit to Hillcrest about what their plans are if they're going back home and things like that. So Cori's already knowing that this person is looking at a short-term stay. Is that true, Cori? And that's how your team takes it, short-term stay?
I think it's assessed at the hospital where the doctor will make recommendations and talk to the families if they're safe at home. Sometimes they'll come in with a goal of being short-term.
Sure. But goals are already being set.
Yes, they have a goal.
Awesome. I think that would probably make people feel more comfortable to know there's goals being set right away, and they're not wondering what's going to happen to them and things. Now we want to backtrack a little bit, and Sandy, you suggested us doing a whole show on insurances and Medicaid and Medicare, but can we just briefly touch upon that you're looking at that when someone's thinking about going into a facility?
Sure. The insurance is really, it's a nightmare at times. It's very confusing. It's, there are certain guidelines that the insurance company requires in order for them to be covered in a skilled nursing facility. Majority of elders would have Medicare. There are guidelines under Medicare that what covers a skilled nursing facility and what doesn't. So that is something that we would work on with them while they're at the hospital to make sure that their insurance is going to cover them. Some patients may have a preferred insurance, an HMO plan or a Blue Cross plan, something like that, non-Medicare or a managed Medicare plan. And those plans we often have to get prior approval for them to go to a skilled nursing facility. So that requires coordination with the hospital, the discharge planner at the hospital, often the therapist at the hospital, to make sure that they're going to have coverage. We have to get the insurance approval prior to them coming. And it's often really beneficial if the family knows ahead of time that this might be something that they're going to have to look into, that they sort of do their homework ahead of time and check with their insurances to make sure that they're going to have coverage in a skilled nursing facility. Not all insurances will cover a skilled nursing facility, so.
Yeah, and I think, especially at this time when you're thinking about having a loved one or yourself going into a facility, you want to know what you're covered for. You don't really want to be worrying about that or having fears or not knowing, because you're going through this process. So your suggestion is to look into this, you know, and know what you're covered for beforehand.
Sure,
yeah,
yes.
that's some good advice.
It's very important.
And again, I think we will do a show based on insurances and Medicaid and Medicare, because it's such a big topic, and we'll get some experts in here. And I'm sure it can take probably even more than a half an hour show to do that, but we'll cover that again. Thank you for briefly touching upon that. And back to you, Cori, because I don't want to leave you out. All of this is in place, and the resident is, your new resident is being discharged from the hospital, and the hospital takes care of the transportation to the affiliate. Is that true, Sandy? Yeah. And you are waiting for the new your new resident to come into the facility, and you're making sure that Hillcrest has in place what kinds of things?
Oh, there's a lot of stuff that goes into place prior to them even leaving the hospital.
Okay.
We'll look at Sandy will send over all the clinical information, as she said. So we want to make sure that all the equipment's ordered if they need a trapeze or specialty equipment.
Sure.
Like she said, for respiratory, we'll make sure that our director of respiratory looks at their pulmonary needs, making sure that equipment's there for that. We also will double check the insurances and make sure that they're ready for that. We will communicate with the admissions nurse and let her know that there's an admission coming in. And we'll also talk to the other departments to let them know. A lot of times they may have dietary needs where we do take patients at Hillcrest. They require TPN or G-tube feedings through the stomach. So we have a registered dietitian that will also look at that. So prior to them even coming in the building, we will look at all their clinical needs as well as their financial needs.
Sure. There's just a lot of things going on that needs to be coordinated. And I'm going to go back to you, Sandy, for just a second. And even though you're at the medical center, you also are talking to other hospitals. Which hospitals do you talk to?
Right now, Berkshire Medical Center is the main base. We also are working with a satellite emergency room at North Adams. Yeah. So anybody that comes into the ER sometimes may need placement directly from the ER. So I work with the staff at North Adams Regional, the satellite for BMC, to have those people placed. I also work with Albany Market. There are sometimes people will come to the local hospital and need to be transferred out to a tertiary hospital such as Albany Medical Center, Bay State. We do have liaisons that are based at Bay State and some of the Boston hospitals, but I do cover the Albany area and some other than New York hospitals as well. In Glens Falls, we occasionally will get somebody from there. St. Peter's, sure. We're seeing more people that are coming from this area going to St. Peter's because some of those hospitals have specialties, sure, that patients may elect to go there for certain procedures to be done, and then they need to come back here for short-term rehab.
Sure, and I think another scenario that people don't often think about is they might be vacationing or doing something out in the Boston area, end up in a hospital, right, there, and then you get a call and you hook them up to have them come to Hillcrest Commons and Cori helps them out, or they have family in the Pittsfield area and they might live in Vermont and they want to come down here, and that's how you guys help those folks out. So that is a big network to coordinate, and very interesting to me because I don't have to coordinate so many things. It's fascinating that you guys can do that. I have a hard time grocery shopping sometimes and getting everything on the list, so thank you for doing that. I want to ask both of you a couple more questions. And Sandy, sometimes you have a patient discharging from the hospital that needs to go into an affiliate, and they pick one of our affiliates. And again, we'll say Hillcrest, and they might not know how to do an IV new treatment, so you guys will go and get that knowledge to the nursing team and they'll learn that. Is that true?
Usually the affiliates, most all of our affiliates have a very good knowledge of the IVs. If there's something they don't know, then within the affiliate, they'll learn it. They'll do education with their staff, sure, and to make sure that everybody is trained and certainly can handle that need.
I think that's great because there's so many things new coming out, and we just stay on top of it. Cori, at Hillcrest Commons, besides rehab therapy, what else, other services do you guys offer over there?
We do the short-term rehabilitation. We actually have a dedicated rehab unit, and then we also have 2 long-term floors. We also have a specialty dementia unit as well, and a specialty behavioral unit. One of our long-term, as I had mentioned, we have a respiratory unit that takes care of a lot of more clinically complex residents up there. Sure. It's 265 beds, which gives us the ability to actually branch out and have a bunch of specialty programs.
Sure. That's a pretty big number.
It's the largest one in Berkshire County. So
I think almost as large as the hospital?
Larger.
Oh, whoa!
Bigger
larger
than the
hospital. Well, that's... Wow. I just recently toured your affiliate and really got a good feeling going through it, talking with the residents and the staff, the short-term folks. Everyone was very positive and very complimentary. But what I liked is that each area felt a little bit different, and even though it is big in number, it didn't feel overwhelming to me, and I felt like comfortable.
It's more like a bunch of little facilities within one big facility. And that's why it's important when CND looks at the person we'll try to help figure out exactly what part of the building or what affiliate the person fits best in. Yeah.
So when we say that large number, I don't want people to get all freaked out. And we were saying we're bigger than the hospital numbers, but it did have that sense. And the staff really, knew who they were responsible for care for and stuff like that. Suggestions for folks who, nobody wants to go through this. Nobody even wants a short-term stay. No one wants surgeries, but it happens. And so we're trying to give you some good information on to prepare yourselves or to have this information available to give to somebody else. Suggestions about maybe looking further into different affiliates, what people should know besides insurance?
Be proactive. Before they need it is when they should be looking. If you know that you're having, and they do that now for orthopedic surgeries, they can go out prior too. But I think if somebody is of a senior age, they should know. There's lots of different community programs that the Berkshire Healthcare Systems provides that people can actually go into the affiliate without it being to tour and just kind of get a feel of the building. I always say that people should tour the building on maybe off hours, meet with the staff, see how the staff are interacting with the residents and the patients, and you know yourself or your family member the best to know if it's going to be a good fit.
Yeah, I think that's a great suggestion to go check out more than one. And what happens is sometimes we have a friend or a family member at a facility, so we go and check it out and pay attention to how that feels to you. And it's always good to know. And I know, Sandy, what you're going to say and reiterate again and again is to know your insurance and have other people in your family or friends know your insurance too, just in case you're the person who needs the care. Again, when you're in a situation, planned or unplanned, it's stressful and emotional. So to have some knowledge going into this, I think, can help it be a smoother care plan and track of care. We are going to take a quick break, but before we do, we want to congratulate Cori Salvini and every single person at Hillcrest Commons Nursing and Rehabilitation Center for doing what, Cori? You say it?
Deficiency-free survey from the Department of Public Health,
Which is a really, really big deal. Super impressed.
Everybody and the whole team is so proud.
And when you and I say the whole team, and Sandy, you'll nod in on this too, the three of us talk about the whole team, from your maintenance department to your nursing to your housekeeping to everybody and the residents, and families and volunteers. That is a huge, big deal. That really shows, it's a clear picture of the life and the quality of life at your home, your affiliate, to get this deficiency-free survey from the Department of Public Health. So congratulations, Cori, and everyone at Hillcrest Commons for making that happen. We're going to take a quick break and actually watch a clip about Hillcrest Commons and see what's going on there. And when we come back, we have a really special guest. So special, I'm not going to say who it is till we get back here. Stay tuned. Watch the clip.
Nestled between the woods of beautiful Burbank Park and the banks of picturesque Onoda Lake, in the heart of the Berkshires in western Massachusetts, Hillcrest Commons is just minutes from downtown Pittsfield, in the heart of the culturally rich Berkshire County. Hillcrest Commons Nursing and Rehabilitation Center offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Hillcrest Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Hillcrest Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. In addition, we also offer more specialized services, including a fully dedicated Alzheimer's unit, a geri-psych behavioral unit, pulmonary and ventilator-dependent care and therapy, and a full bariatric weight loss program. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Hillcrest Commons is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident and patient at Hillcrest Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Hillcrest Commons Nursing and Rehabilitation Center, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing-supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-445-2300. We look forward to meeting you.
Welcome back to InfoSource, and joining me is Linda Tyre, City Clerk of Pittsfield. Thank you for coming.
My pleasure. Happy to be here.
I am so excited to talk about this. And I bet people are thinking, what are they going to talk about? What are they going to talk about?
What does this have to do with health care?
What does this have to do with anything? But this has to do with something I want people at home to know, that just because they spend some time at one of our affiliates or any other facility, that they still have the right to vote. You can vote in any election, state or federal, that goes on while you're at a facility for long-term or short-term care. Is that true, Linda?
Yes,
and that
absolutely true.
Oh, thank you.
Yes, that is true. So what happens with a resident who may come into one of your facilities? They do not relinquish their right to vote or their ability to participate in any election, whether it's a local election, state election, or federal election. And they can do this by absentee ballot. So how it works is, let's say that you have someone from Pittsfield who goes into one of your facilities on a temporary basis. They would still use their permanent address as their voting address, but we would send them an absentee ballot that's appropriate for their permanent address.
That sounds so simple, but it's so important, and a lot of people don't do it.
So the absentee balloting process is actually 2 steps.
Okay.
The first step is the patient or family member needs to complete an application. They submit the application to my office, and then we process the application and mail a ballot to the resident to an address of their choice. It could be their home address or to your facility directly.
That's even simpler, isn't it?
Right. So then the voter can complete their paperwork, mark their ballot, mail it back to us, or it can be hand-delivered by someone to us.
And I think the most important thing for us to tell people is you still have the right to vote, whether you're at an affiliate, a facility, or not. You can vote by absentee ballot, and please vote. It's important.
It's very important to vote. I'm always trying to encourage participation, and we have a lot of registered voters in the city of Pittsfield. And over time, we seem to have lost voter turnout. And you know, these are important decisions that voters are making. You're choosing your elected officials, the people who are going to be making important decisions about your community. You're choosing your state elected representatives or your federal representatives. So
we want you to vote.
We want you to vote.
Linda, thank you for coming on the show, because we want you to vote.
And you can.
Thank you. You can. And thank you out there for watching. We hope you have gained some knowledge from the information we shared with you about being discharged from the hospital and admitted to a facility, and hope we've eased some of your worries about that. We hope you stay tuned to next month's show, where we talk about a stay at an affiliate and tell you how that looks like, and ease some of that. So thank you for watching InfoSource. We are a presentation of Berkshire Healthcare Systems. Thanks.